Welcome back to the podcast, ladies and gentlemen. Today, I'm thrilled to introduce a doctor who has made incredible strides in his career over the past few years. He's an ENT surgeon with 5 years of experience in the NHS, but what truly stands out about him is his remarkable growth and development. Having had the privilege of appraising him for the last 3 years, I've seen firsthand how he has matured, refined his skills, and handled complex situations with confidence and composure. He has not only passed an important exam in his journey, but he is also rapidly advancing in his subspecialty, mastering intricate procedures in skull-based journey, thyroid surgery, and rhinoplasty. On top of that, he is known for his excellent communication, great teamwork, and fantastic sense of humor, which I know will make his conversation both insightful and enjoyable. So let's dive into his journey, his challenges, and his advice for fellow overseas doctors. So please join me to welcome Dr. Amin. Thank you for joining us today, Dr. Amin.
Thank you very much for this opportunity, Dr. Mohamed, and thank you again for all of these nice words. I really appreciate it.
I think you deserve it. I've seen it firsthand, and I think you truly deserve it. So you've done amazing progression in your way of delivering your message across, and how you conducted your last appraisal was remarkable. So congratulations for really achieving this progression in your career in the NHS.
Thank you very much. And also what we are going to discuss today, all of that happened by support and encouragement of all of colleagues and senior colleagues like you, like all of team members of my hospitals, which was actually, as you said, it was very hard journey, but it deserved. It was very interesting journey with some challenges and
excellent. And that's why you're here today, to share your challenges, your ups and downs, and how you could help other overseas doctors to overcome their difficulties, especially when they first arrive. So I'm going to start with the first question now, and say, looking back at the first day in the NHS and in the UK for you, what was your first impression of working in the NHS?
Yes, so first impression when I worked in NHS, it was full of excitement and motivation, because you finally you felt at the point that you reach what you want to do, and you achieved some progress, because you know that to be a doctor or be a registrar in ENT is not easy. You have to be a member of our College of Surgeons. You do some exams, you do training. So when I came from my back country, Egypt, I did training.
Okay.
And so when I reached in UK, I felt, oh, wow, finally I reached UK, and this was my dream.
Okay.
So it was a moment with full of excitement, full of happiness.
Of course.
And I feel that because of this moment of a lot of emotions, sometimes you start to feel that there is some misunderstanding, or some points you didn't understand well until you start working.
Okay. So what you're saying is you had this sense of achievement that you moved to the UK, which is a big achievement on its own, which I agree with you. To many of us, it was a big achievement, and it's something that you can, of course, feel and build on until you discover the NHS.
Exactly.
Right?
Exactly.
Which leads us to the second question now. Yeah. Now, can you describe to me a moment when you realized that things work differently, or actually very differently, when compared to your home country?
Yeah. A lot of principles when you start working, maybe in first days, when you start to do ward rounds with your team members, with your colleagues. And during in your ward rounds, you start to feel that because in your previous experience, you have a concept in your mind that a consultant is a senior consultant. He knows everything.
Sure.
This is on our background.
Yeah.
That senior consultant, he knows everything. Mm-hmm. He doesn't need to take opinion from
anyone.
Other members.
That's true.
He
has, of course, wrong. I'm saying it's true that this happens, all over the world.
Exactly. Yeah. Exactly. And here, once you start to in UK, you start to feel that we do ward round consultant. Mm-hmm. and you realize that the consultant is taking opinion from you, taking opinion from myself. I'm just started.
Yeah.
I'm a junior colleague, and even he's taking opinion from even younger doctor like CHOs, and after that he started taking opinion from nurses, physiotherapists. This will give you some sort of
imbalance.
Yeah. What's going on here?
Right. But how did it make you feel when you first saw this firsthand?
Yeah, it gave me some sort of inconfidence or a loss of trust in the system, or what's going on. Is he a consultant or not?
That's very interesting. That you've shared this. So your first impression that you did not trust that this consultant knows what he's doing because he's asking people around.
Yeah.
Right. That's very, very interesting. And I'm sure many of you have experienced the same. But actually, I'm confident you've changed your mind right now, right?
Exactly.
So tell me how you see it right now.
Yeah, I'm speaking about my feeling or my impression at that moment. But then I started to realize that no, this is some sort of teamwork.
Yes,
some
teamwork.
Teamwork that all of us learning from each other. This is another concept. And then start to realize that there's something else is called practice evidence-based. It's not practice evidence based on our individual judgment or our individual experience.
What we feel about.
Our impressions. So in that situation, you start to change your mind. Okay, so in this, it means that we all of us working in the same platform and with the same experience, not same experience, but at least
we sharing experience. And all of this experience that we share and we work together is to deliver one thing, which is delivering best and safe patient care.
Exactly.
And as far as we all understand that this is our target, working in any hospital, we will then collaborate, teamwork, give advice, ask for advice, and ask for help to achieve this one single outcome, which is delivering the best and safe patient care. Really, thank you for sharing this, because I think it takes a lot of courage to share how you actually saw the system as a new doctor, because I'm confident that many has seen the system in the same way. And you also shared how now you see it and how you understand how powerful it is to ask juniors and other disciplines to help you reach the diagnosis, to help the patient care. But this was a challenge, but what was the biggest challenge you had in the first year when you first started here?
Yes, so for challenges, definitely I had a lot of challenges in the beginning. One of these challenging, it was style of communication. Communication is very important, and that's what I realized afterward. As a communication is very important in to be a good physician. Communication with patient, communication with colleagues.
Sure.
And after that, I understood that here communication is what we call patient-centered communication.
Sure.
In my previous experience, patient always rely on doctor and defer all decision to the doctor.
Sure.
Here in what I realized in UK, even before I came here to NHS experience, I did exam, I did a membership at college, so I did examination for communication. But when you start to work, it's totally sometimes.
Of course, it's nothing like having practical experience.
Exactly.
Of course, yeah.
Exactly. So when I started working, I found that in NHS you have to explain all details to the patient.
Yeah.
In all perspective.
Good.
And also
give them choices.
Exactly.
Give them choices.
You have to give them choices and options. There's options that wait and see.
Okay.
Option will do follow-up surveillance.
Yeah.
Not all option to do
surgery. Of course. Yeah, absolutely.
And this is totally different for a surgeon. So because we believe that as a surgeon, I have to do surgery.
Yeah.
I will not wasting time.
Yeah, of course. Yeah.
So, and then I found that I have to tell the patient, and I respect the decision of the patient. I have to ask the patient about his social background, to understand his performance status and how this will affect our decision. So communication style, I found It's completely different. And to understand that and start to apply in your
Practice is powerful as well.
sometimes.
And you bring to my mind now that also, apart from what you said, not to be judgmental.
Exactly.
So you have to understand the reasons that can be different for other people, and you may not understand it, but you really have to believe in it. And don't judge people for whatever they think or whatever they feel, because it's really easy for us to kind of show some emotion, but in the background, in our mind, we kind of undermine what they said. And it is actually, it's not fair on the patient, because actually we should respect patient wishes, respect patient emotion and feeling and what they are communicating to us, because they trust us. And if they trust us to say what they actually feel, we have to really be in that position to, be worthy of this trust and believe in them and not be judgmental. Because
Exactly.
I've seen many doctors, especially overseas doctors, unfortunately, where, after a conversation about the patient, they will kind of say, what is this patient talking about? But I think it's not our duty to judge. But it takes maturity,
Yeah.
it takes experience, and it takes having a mindset of adapting to the system and really becoming better in what you say. So no, thank you for sharing this point. I think it helps people to understand that there is difference between, where everyone came from overseas and the UK, and there should be a way of integration and adaptation so as we all practice safely, if for one purpose is delivering best patient care. So that's really powerful. But I'm sure that you would have something to share with me about any small and perhaps surprising things that confused you at first when you came to the UK, like asking a nurse for an instrument or requesting a scan.
Yes, definitely. This is another situations. Also, it's considered as a communication with colleague, because I remember when I started in surgery here. One day I was in operating theater.
Okay.
And I was at the end of surgery, and I was tired, and I want to finish. Then I asked the nurse, "Could you give me a suture, please?"
A suture.
Suture.
Yeah.
And in my previous experience, when I asked a nurse to, when I asked
You mean where you came from?
before,
Okay.
when I asked the nurse to give me sutures, she give me whatever available sutures, and I have to work with it.
Okay. Yeah.
Whatever. It doesn't matter how you will work with it,
Okay.
but you have to.
You have to find a way to deal with it. Okay.
Exactly. So this happened with me. I asked nurse here
In the UK, yeah.
UK in NHS, please give me sutures. So she started to ask me a lot of questions. What type of sutures? What kind of sutures? What kind of needle? Cutting around the needle.
Okay.
All of this.
There's like a big dilemma there.
Yeah, and I'm tired. And then the end of the surgery, I
You just want to finish.
I already finished.
Okay.
The big part. I want just to close.
Yeah.
Oh, I found myself stuck.
Yeah. Frustrated?
Not frustrated,
But stuck.
but stuck.
Okay.
Like frozen.
Okay.
And then I start thinking about myself. Okay, I have to think which type of suture. And I found a nurse which is good actually. She's very strict. She knows what she's doing.
Yeah. Very professional.
Very professional.
Yeah.
And she will give you whatever you ask for. And she was expecting from my side
To be specific on what you want. Yeah.
what you want, Mr. Ami.
Yeah.
And a situation like this, and then you give you expression that there is different mentality because of resources.
Sure.
And this is good. We have a lot of resources. You have a lot of choices, but at the end you have to think wisely and how to
Choose the right option for the
right
patient.
option. Exactly.
Amazing. That's really helpful to share.
It was funny, and also at the end, all of that give conclusions that all of that for the patient safety, patient good outcome, and
Of course. I have also experienced with nurses when I started working in the UK and moving here as well, is I found them as a problem solver, a problem solving, colleague. So they've seen many surgeons doing some stuff. I was doing intervention radiology, and I got stuck on something. And I just was trying and was trying and was trying. And then the nurse said, "Oh, shall I get you this?" And I said, "Oh, yes, of course. Yeah, can you get it from me?" You know, going back to how I think, I wanted to show that, yeah, I was thinking of it, but at the same time, appreciated she actually gave me a hand by suggesting the right instrument to use. And I actually used it, and it made my life easy.
Yeah.
So because you are stuck, you are focused on what you're doing, you don't have this overview vision of what you're doing right now. But the nurse he or she is sitting there or watching you and helping you. And I've seen many other doctors doing the same procedure in different ways, so they would give you a bit of advice. So I really value nurses here because they're really professional and they
Exactly.
really very helpful.
And main figure in our team.
Of course,
Yeah,
of course.
really.
And they can make your life, you know, heaven or hell. Yes. Do you agree?
Totally agree.
Do you agree?
Yeah, I agree.
Exactly.
And this is what I believe now. That's now. That's why when I go to theater, operating theater, all of nurses are my friends.
Amazing.
They always like to operate with me.
Okay, that's good.
There is a harmony.
That's an achievement. That's very good. Well done. Because many doctors, they don't realize this until it's very, very late, or sometimes even don't realize it. And they all have this bad and negative vibes with nurses because they are used to treat nurses in a different way in different healthcare systems, which they think it's okay to carry on doing it here. But when they do it here, they can get away with it for, you know, a few years. But at some point, things will go very bad. And then this doctor will find him or herself in a very bad, sticky situation.
And actually, and this is remind me about other thing, which I found it's very important as well. The concept of help. You know, Dr. Mohamed, that again, usually what we believe or what we believed before, that when you ask for help, it means that you are
not competent. Yeah. Yeah.
And
Which is not true. Which is not true. Yeah.
and you are not a good doctor. You're asking for help, it means that you don't know what you are doing.
Yeah.
And it's considered a weak point for you. And this is very important for all of international doctors when they are coming. I'm saying that I'm trying to tell them advice not to feel that. Here, if you ask for help, it's totally different.
Of course. It's getting appreciated.
Exactly.
Yeah.
Get appreciated. It means that you are a safe doctor. You are aware about your own limits.
Yeah.
You are keen in your patient. So you asking for help means that you need to give the patient
Best patient care. Yeah, absolutely. Absolutely.
even if you ask for help from nurse, how can I do this in better way? Nurses, as you said, they can give you some fine
Tuning.
It will make
Your life easier. Absolutely. Absolutely. Totally agree with you. Totally. That's very powerful advice because I've recently written a book on the 6 biggest mistakes overseas doctors make that could get them into trouble. And one of the mistakes is not asking for help. So I'm glad you've mentioned this. And yeah, it's a matter of pride. I'm a doctor. How can I ask for help? But actually, it doesn't work this way. If you're a doctor and you need help, then it makes you a powerful doctor and more safe doctor to ask for help whenever it's needed. So, no, thanks for mentioning this point. It's a really big mistake, and many people fall into trouble because they kind of take a bigger size shoes than they can walk into. And this will make them fall into mistakes and trouble. And then when it comes to, to the point where it becomes an incident or serious incident, why haven't you asked for help? Exactly. There's no justification. And there's no way that he's going to get out of it, he or she, safely of this situation. Okay, thank you really for sharing all these lovely experiences and really honest moments about how you felt about the system. But if you would go back and give your younger self one piece of advice before starting in the NHS, what would that be?
Yeah, I feel that maybe a little bit difficult question, but if I could go back and ask, give myself one piece of advice, it would be to be patient, to be self-confident, and to be aware that the system, once the system hires you, it means that the system needs you.
Okay.
So you have to think now how to be integrate into the system.
Excellent. Excellent.
So there is no one against you, and but you have to be patient. Take your time. Don't be in rush, because this is what happened with me. So when I came, I found I know everything. I can help the system. I have experience.
Sure.
I have a good knowledge.
You can change the world.
Exactly.
Yeah.
But then you start to realize that a lot of things, a lot of protocols, a lot of guidelines.
Yeah, absolutely. Absolutely.
And this is what another advice as well, that if you are coming to work in NHS, if you keep your mind aware about some nice guidelines, NHS guidelines, NHS protocols,
Hospital protocols
hospital
itself.
protocol, your trust protocols.
Absolutely.
This will make your life easier. As in our field as ENT, as we spoken about communication with patients, we have an ENT. Luckily that we have an ENT. Something is called ENT UK, big website, and this website provide patient leaflets.
Okay.
So this patient leaflet is very helpful for you, for your communication with clinical consultation. Nowadays, I'm usually using this patient leaflet.
Okay.
After discussion with the patient, I'm aware that there is a patient leaflet about rhinoplasty, tonsillectomy.
Very powerful, yeah.
And I found that this patient leaflet is really supportive to doctors because it's
And patients.
and patient.
Yeah.
I mean, supportive to doctor with patient, because when you're speaking about like risks for surgery, it looks sometimes scary to speak about risks with the patient.
Of course.
But if you give the patient that ENT UK leaflet to read at home, you are aware that there is ENT UK leaflet. What is
Is it ENT UK?
ENT UK
Yes. Okay.
website? It's a very good website.
Okay.
And I'm sure that all of different specialties definitely
Will have a similar.
similar.
Yeah, that's true.
Exactly.
That's true.
So
So the guide or the point you're trying to make is always start to make sure there is any guide for you on how to communicate with patient, because communication is a key.
exactly.
Thank you. Thank you for highlighting this.
Yeah.
Well, what do you think the role of of a mentor in helping? Because you said integration is a key, but how would people integrate? People integrate with different ways. What do you think the role of a mentor to help overseas doctor integrate in the NHS?
Actually, it's very important, very significant. And luckily, what I believe that I had a very good mentors, because mentors, especially if these mentors have a background, the same background, or
Yes.
if they are before they were international doctors and they working in the system for 10 years or 20 years. So these mentors, they know exactly your background and they know the system.
Yes.
So they will be aware about your weaknesses. They will give you a real advice. They will tell you what you need.
Okay.
Maybe they will give you awareness about your rights, how to work. They will tell you, take care about these things.
Excellent.
So it will be very helpful advice.
Okay.
And mentor in my journey changed my
Crucial. Was crucial.
Very
Definitely. Definitely. I always say mentoring will shorten your time to get the experience that you need.
exactly.
Will save you a lot of time. Will save you a lot of money, because it's going to be from someone who's walked the walk and went through all what you've been through and came out of it. And they would want to help you if you ask for help.
Yes.
So I would suggest, like you've done, like how I've done, to seek mentorship. And if you really can't find someone who can mentor you in your hospital, you should reach out mentorship at anyone, any department. It doesn't have to be in your department.
Exactly.
Of course, your department will be better because they'll give you also mentorship on your skills and your, surgical abilities or clinical, mentorship. But you need mentorship on how to navigate the system, how to understand the unspoken language. And whenever there's mentorship, and, some of the mentorship was for free, but I also had to pay a lot of money for mentorship program that I had to join to understand the system better, to understand how things are communicating, because I've been into leadership roles within NHS. So I had to see things a different way, understand and behave differently, and really communicate differently. So I had to invest a lot of money into mentorship programs to help me mature as a doctor, mature as a consultant, and mature as a person really is keen about improving patient care, because sometimes you may be interested and really keen, doctor, on improving patient care, but not doing the right steps can actually get you a worse outcome. So mentorship for me was a key, and I really invested a lot of money on this, and I will continue to invest till my last day in life, because it actually what made me a mature doctor who is really focused on patient care and focused on my personal development to deliver best patient care. So yeah, totally agree with you. Mentorship is a key, and everyone should actually find a way to get mentorship.
Exactly.
I really want to thank you for your sharing your experience and, reflecting on your first day, following days, and how you saw the system initially and how you matured and saw it differently. So I also want to ask your input about the appraisal system in the UK, and how did you find it helpful, and how having a different appraisal could give you a different flavor of how you do the appraisal. So it would be helpful if you could share this with everyone, because some people think it's just a tick box exercise, but I don't think it is. It's for you and about you as a doctor to help you develop, become better, successful doctor, and script your success and script your progress within the NHS. So it's for you. You should do it. But I would love to hear from you to share your experience about how or what is a good appraisal, or what is a good appraisal for you.
Yes, definitely. This what I also, the other thing what I found here is the process of appraisal and revalidation. Actually, this appraisal, one of the things that when we came here, we found we misunderstood what the appraisal. And after that, I realized that appraisal is something for myself, for improvement, to show improvement for myself.
That's true.
To show that you are a safe doctor, you are doing improvement in your career, you are practicing on standards with GMC standards, and you are strict to your guidelines.
Yeah, absolutely.
So actually, if you do a proper appraisal, it will be protecting you. It will show that you are in proper way. And also, yes, you're right, Dr. Mohamed, that most of us, we took appraisal in the beginning, initially, that in negative way. Why are we doing this appraisal? Why are you doing this paper?
It's not necessary. It's too much.
Too much questions, and they asking about your feeling, how you found that, and all of these open questions. For myself, I found in the beginning, found it difficult. And because I couldn't understand it well, I found difficult to manage and to do appraisal in proper way.
Sure.
But after that, I started to understand the process. I understand the mentality behind the appraisal.
Yeah.
Why, the reason for appraisal.
Sure.
And once you understand, you start to do it proper way. And thankfully that I did with you, it was very good. That I did a show with progress. You explained to me how to do appraisal and how to show progress, how to
articulate
your personal plans,
of course, gather evidence, and how to use it to your advantage, basically. And it was good that you actually took it seriously, because some people would take it negatively. You say, oh, why all this hassle? I've done my last appraisal in 10 minutes. Why are you taking 1 hour, 1 hour and a half to criticize me and then send it back to me? I know it was a painful journey for you first time, because I sent it to you maybe twice back, but it was what helped you to mature and make your final appraisal, which was amazing, and I actually approved it straight away and authorized it straight away, right?
Exactly. Yes.
So you can see the progress, which is amazing. Again, thank you for sharing your experience about appraisal and how you set it in the UK and how you progressed, which is really powerful. And I'm sure that all the audiences listening and tuning to us today will have an amazing advice from you on how they could actually progress in the UK. But let me ask you something different. Along this journey, you must have seen things that were not common back home, your country where you came from, and wanted to ask you, what was the weirdest or most precious thing that you now find yourself doing that you never thought you would do?
Yeah, this is a very nice question. The first thing that I found that I myself nowadays I'm doing before I didn't expect
again.
myself that I will do that. Just asking about weather.
Okay. Okay. Yeah, I think this is the common question here.
Yeah, or asking about,
Or mourning about the weather.
yeah, and where is the sun? It's sunny today. Oh, sunny.
Yeah, I can imagine. Yeah, it's a very British thing.
Yes, exactly.
Right, Alex? Alex sitting there in the background, yeah. It's a very British thing. Yeah, everyone moans about the weather, asks about the weather, and the weather is the main topic.
Exactly. Before, I didn't know that. Even I didn't expect myself that I will think about weather at any time.
Yeah, I totally agree with you. We all look and ask about the weather every single day. This is a very British thing.
Yeah.
My British thing is saying sorry for a thing that I haven't done wrong. So,
Yeah.
like anything like sorry. If you bump into someone, I'm sorry. If anything falls down, I'm sorry. If you lost your key or whatever, I'm just sorry all the time. So this is, we never used to say this before. Sorry, everything. Even if you're not wrong, you would say sorry.
Yeah.
It's very polite, but it's very British as well. So this is my British thing. Let me ask you this question as well. If medicine had a reality TV show, which NHS specialty would be the most dramatic and why?
You mean most dramatic in what ways?
Anyway, like it's a drama show and you see this subspecialty. I'm sure you deal with all subspecialties, radiology, pathology, orthopedic surgery. Which one you need to be thinking, oh, this is very dramatic. They're always dramatic. They're always, up in the air with what they think. No offense to anyone of the audiences from any specialty, but this is just,
I didn't think about that before, but because usually, as I said, usually I show respect to all my colleagues and different specialties.
We all show respect.
And I believe that all of them are very important. But sometimes I feel, because before I'd like to be a psychiatrist, so maybe I feel sometimes that psychiatry or psychology is one of dramatic.
Yeah, it can be dramatic, yes.
Definitely a lot of drama, a lot of
events and very odd things, experiences.
Stories.
Amazing. So if you had a role to play in this drama, what subspecialty would you like to work in?
If I will be in drama, definitely I would like to be a psychiatrist
as well.
Because in real life I couldn't be a psychiatrist.
So you would want to do it there.
And also because I like to read books.
Okay.
There is a very nice books about it's called Psychiatric Stories.
Okay.
Very dramatic books speaking about story of patients, like not patient in
real patients,
real patient, but it will give you symptoms of disease in a story. Very
interesting. Very insightful. Yes. Wow, never heard of this before. What's it called again?
It's called Psychiatric Stories.
Psychiatric Stories. That's another book for you guys to read. If you want to read a book on something fun in medicine, it's Psychiatric Stories. One other fun thing I want to ask you. What's one fun or adventurous thing you've done recently that made you feel alive?
I have always what I do give me energy and energetic, and I feel good mood when I go to gym. Actually, we work out and go to gym and do push up and all of these exercises.
Okay.
And
brings life back to you. Bring you back to life.
Bring to me life. Yes.
Make you strong.
Exactly.
Make you feel as a Superman or Batman. I feel like a Batman today.
Yes.
Oh, this is Batman.
Oh, good. But especially nowadays in winter, that you can do a lot of outdoor activities. So if you go to gym, you feel different mood. And in summer, when I go outside, I like to go playing tennis. Also, playing tennis gives me a lot of energy. And
amazing. I think any sort of sport and exercise also energizes me.
Exactly.
And it's amazing. Right. So we're coming really towards the end, although I really enjoyed the podcast with you today. If you weren't a doctor, but working in a hospital and had the opportunity to work in a non-medical job, what job would you choose and why?
I would be a manager.
A manager, okay. You just say this without even thinking. Why is that?
No. I didn't think about that before. Actually, I like to be a doctor.
Yes. Well, you said if you're not a doctor, but you can work something different, you chose a manager. Why did you choose man? Why did it just came to you?
Maybe because this is what also I realize here, that the rule of management is very efficient and very crucial in the
Managing healthcare.
And they have a lot of responsibilities. They're doing a lot of work. And also, doctors sometimes they feel that if they will do the job of managers, they will do it in better way.
Yeah, of course. But do you think managers' job has gone far beyond what they're supposed to do, or do you think they are doing something good for the NHS and the patient?
I feel that in general they're doing good, because we know perfectionism
Doesn't exist.
thinking is very easy.
Yeah.
But all of us are limited with resources, with time, with workload, with a lot of patient. So in general, yes, they're doing good.
Good job. I think you can make a mixed response on this. Some will think like you, they're doing excellent job. Some will think that there's too many managers, even more than what you need in any department, in the way that they sometimes may interfere with each other.
Yeah.
So, yeah, I'm sure your experience is different than other people experience, but talking to other doctors, they have said that managers are helpful, as you quite rightly said, and I agree with this. But there are some departments which have more managers,
Yeah.
and when there's a problem, instead of getting a doctor to do the job to solve it, they will try to get a manager to add more workload to the doctor and maybe cut their free time and interfere with their job plan to make them more productive, and not allowing for, doctors are not machines. They are humans, and they have the, ability to work hard one day, and maybe slower the other day. So expect them to give the same outcome every day like a machine doesn't exist. So, and this what sometimes paints some of the managers with negativity in the NHS. And I think there's something need to be addressed by the NHS as well. But it's not our topic today. So we can leave it for now. So I'm not sure if you like traveling or no, but this is a time to ask you, what is the best country you visited and what made it unforgettable for you?
Yeah, I like traveling. I like traveling a lot. I don't have in my mind a particular city, but I went last year Miami. We had a conference, American Academy Conference in Miami, Florida. It was very
nice. Miami is amazing.
And we had a nice we enjoyed days there. Good weather and sea. It found that very nice.
Miami. Okay, I've never been to Miami. I would love to go there. But yeah, I'm confident it's going to be an amazing place when I go there. I really want to thank you for sharing your experiences, your ups and downs in your NHS journey, and how you benefited from mentoring and for asking for help, and how you've really worked on communication and understanding the system to make yourself becoming a better doctor and a safe doctor in the NHS. Really want to thank you for sharing your insight. I'm confident everyone will benefit from what you've said. And I got now one last question for you, so we can end this amazing podcast that I really enjoyed talking with you today. If you had to sum up your medical career in 3 emojis, which one would you pick?
Oh, yeah, 3 emojis. Over the last 5 years in my journey, sometimes crying.
Oh dear, okay.
Yeah, we had a lot of challenges, exams, but at the end, initially came back as happy and sometimes confused.
Okay.
But always I'm trying to be happy.
Excellent. Well, Mr. Amin, thank you so much for your time. Thank you for finishing the podcast on this very happy notes that you have gone through ups and downs, but it ends with a happy moment and happy smiley face. And I'm confident everyone will enjoy this podcast. And thank you again for your time. And thank you for investing the time with us today, because I really enjoyed it. I'm repeating this again now. And would like to have you again on this podcast to discuss other topics that will definitely help all the audiences listening and tuning and watching us today, finding their journey in the NHS. So thank you very much for your time, and thank you for your experience.
Thank you,
so
Dr.
much.
Mohamed.
Thank you
very much. And very kind for you and yourself to invite me in this podcast.
Thank you. Thank you for coming.
I appreciate this spirit.
Thank you. Ladies and gentlemen, I hope you enjoyed this podcast as I have enjoyed it thoroughly. And I'm confident you'll have tons of values there. Please stay tuned and make sure that you implement every single wisdom you heard in this podcast. Make sure you do your appraisal properly. Take it as seriously as possible, not just a tick box exercise. Make sure you choose a mentor that will help you to navigate the system and shorten the period that you need. Instead of spending years to understand the system, can make it month or even less than a year. It's important to invest in mentorship. It's important to ask people around, and it's important to use NHS guidance to make you a better and a safe doctor to deliver best patient care. Thank you, everyone, for tuning in. I'm definitely going to see you on the next episode. Thank you.